Well, look at that. We are going live. It says we're live. I hear the train a-coming. It's rolling round the bend. And I ain't seen the sunshine since I don't know when. I'm stuck in Rock County where they're still quarantined. Hence the black shirt. Hello and shalom. Welcome to the Chat with the Docs webcast. I am Mo.
And I'm Dr. Noel Margoski.
We are the practitioners at the Siloam Center for Traditional Medicine in Janesville, Wisconsin. I like to call it Janesburg. It gives it more of a homey feel. We are live again, and this week we're talking about low back pain, and we are trying to answer the question, is it sacral? I have had my coffee this morning, and so therefore I'm a little hyper. Fortunately, the jittery aspect of it has worn off.
I'm just waiting for mine to kick in.
Good luck with that. Well, then again, you do have the economical 50-gallon drum by you. Quality, not quantity. Anyway, today we are talking about low back pain. All things low back. Well, not all things. This is only an hour show. And the number of lectures that they make you sit in, I'm assuming in chiropractic school on low back pain would be forever. Mm-hmm. I mean, in herbs class, we had our teaching doctor that came over from China. He talked about nausea and vomiting almost every lecture. But when he got to the nausea and vomiting lecture itself, that was 3 hours of nothing but nausea and vomiting. We're talking intense.
That's intense.
So we're gonna talk as much as we can in an hour show that Mo has just wasted 2 minutes of. I'm guilty.
We're gonna go down the rabbit hole.
We're gonna go down the rabbit hole. We're gonna limp down the rabbit hole because if your low back is hurting, you gonna be limping. So at this point in the show, I just want to say that if your county in Wisconsin here is opened up, kudos to you. Enjoy it. Use some wisdom, but enjoy it. Rock County, we're still closed down. Dane is closed down. Is Jefferson County still closed down?
I think Jefferson is open. Dodge County is definitely open.
Okay, so
it changes too, because I think Waukesha was for a bit, but now they're reopened. So
if your county is open, great. Use some wisdom going out. Keep in mind, as I'm going to tread on some thin ice here, but keep in mind the masks are largely a placebo.
Don't get overconfident with them.
They're basically a fashion statement at this point. The reason I say this is if you are using an N95 mask, I mean, we're talking the correct type of mask from what we're told to wear. And if it's tight and sealed, so you're not getting any air coming in through the sides, your mask has porosity of something around 120 to 160 nanometers in size are the holes in that N95 mask. The problem with that?
You can hardly breathe.
You can hardly breathe, but this virus that we're all trying to wear the masks to combat is between 60 and 100 nanometers in size. Mm-hmm. So you're basically trying to net mosquitoes with a chain link fence. It ain't going to work.
And if you move it down to breathe with your nose or talk to somebody.
And every time you adjust that mask, anything that's on the mask that's getting sucked to it is now on your fingers, and then you do this. And people are finding, and studies have proven, that you touch your face a lot more with a mask or when you're doing one of these stupid shows that we do. So if you want to wear a mask to feel better about, just to feel a little safer, go ahead, wear it. Keep in mind, do not touch it, and keep in mind that the cloth masks are a lot more porous than the N95s, and just use some common sense. Keep washing your hands. Keep at least 3 feet away from other people. If somebody sneezes, don't walk through it. Don't know why you'd want to anyway. By the way, yesterday I got home. I went through the kids, gave everybody a kiss on the forehead, got a hug from my 2-year-old. My wife hugged me, patted me on the head and said, "Welcome home, dear." And then the dogs were there. And I went from Stanley to Oliver to Patches to my old dog, Hank. And Hank loves me. Cataracts and all. He looks through those blue cataracts and he just says, "I think you're wonderful," which is why we get along so well. And I went down and I held his face and I said, "Oh, Henry," and he went, "Huh," and he sneezed in my face. So I just want to say publicly, Hank, thank you. Then you got to go and you got to decontaminate yourself, get the squeegees out, and it was a mess. Anyway, welcome to the show.
Dog sneezes.
I've now wasted single-handedly. This isn't on you. This is on me. I have now single-handedly wasted 6 minutes. So with that said, if you're going to wear a mask, use some wisdom because it's not doing all that much to protect you. If you're thinking you're getting sick, have a qualified practitioner check you out. It's not worth being terrified over, but it's not something that you want to just
because the restrictions are
lightly.
Lifted, it doesn't mean throw caution to the wind. Still practice safe hygiene.
Yes. We had a ranch hand when I was a kid who had all of his teeth pulled because the hygiene practice of brushing his teeth was taking too much time in the morning.
Wow.
At least that's what his story was. Anyway, I don't recommend Bohannon's method of hygiene. So, low back pain. It is the acupuncturist's bread and butter. It's the chiropractor's, I almost said chiropractorist. In fact, I did say chiropractor. It's the chiro's bread and butter.
Yep.
And it is foundational to everything. You've got the 2 ends of the spine. You've got the sacrum down on below, and you've got the cervical up above. If something's going on in one side, you're going to have pain on the other. Mm-hmm. Take it away, Doc.
So kind of like we went over the shoulder 2 weeks ago, I think.
I think so.
Yeah. So I'll start from the outside and kind of go in more to the nerves. So when you're looking at your low back, you have the 2 big muscles on the sides through here. That's the quadratus lumborum. That's usually a big one that people find spasm or they notice the low back pain and tension right away. Then you also have your glutes that sit here over the hips. These are the true hips. We're not talking as much about these or, the pelvis. So
talking that iliac crest,
yes.
that wing that you
yes.
feel when you press in just below your belt. What in the old days you could get a pair of pants and your belt rested on? Mm-hmm. That's your hip bones.
Yep.
That's the iliac crest.
Sometimes people will say hip and it's like, okay, are we talking about this or are we talking about this? But today, like when I say hip, I'm meaning the hips up here. So then you have the glutes coming through, and then you have the hamstrings that connect underneath and they come down onto the legs. Then you have the IT band, which is the big long piece of fascia that hooks into the glutes and comes down the side of the leg. Now I go over those structures just because they all play a big part in with the low back pain that a lot of people feel. So once you go one layer in, we have the bone, we have the nerves here.
We've got the nerve. I just had to say that.
When we work with the low back, I'm working with adjusting the segments of the spine, of the pelvis, to make sure that the disc is in proper alignment. Because if that disc is out of place or bulging or just obstructed a little bit, you will have pressure on the nerves that come out. What about you, Mo? Is that pretty much how yours kind of works? You're working on taking the pressure off the nerves?
Yes. Anytime you're looking at what's typically diagnosed as a disc issue, bulging disc, herniated disc, etc., the dirty little secret is 70-some% of the time, and forgive me for not being specific, but 70-some% of the time, people above the age of 35 have at least one herniated disc or bulging disc that's asymptomatic.
Yep.
So if you're talking, 3/4 of the time, that's already there. That damage is already there in the disc. Then what's causing the pressure on the nerve? Because there's a lot of pressure or a lot of room around this nerve root, even if we have a bulging disc.
Yeah.
So what's causing that? 9 times out of 10, it's muscle that's spasmed down, and the muscle is actually pressing the nerve onto the disc. And so therefore, if we can use the acupuncture to do a release of that muscle tissue, and I don't like to do it locally. Usually you can get a better result by going into the feet or the hands or some other place on the body than just going directly here. You get bigger bang for your buck. But getting that tissue, that soft tissue, that muscle to quit spasming, to have greater blood flow through the area so that any torn tissues can start to repair. The mitochondria in those muscle fibers can start getting the equipment that they need. That's, from an acupuncture standpoint, functionally what we're doing. Theoretically, what we're doing is anytime there's back pain or knee pain in Chinese medicine, classically you always say, kidney qi deficiency. And your kidneys have caused your knees to be weak. Your kidneys have caused your back to be weak. And so herbally, you're looking at kidney strengthening herbs. Why? Because your kidneys are sitting right up in here, and your kidneys have an influence over all of this tissue.
They share the nerves. Don't just go to, like, let's say the kidney, it doesn't just go to the muscle, they go to both. So that's why you're able to treat kidney and have an effect on different
parts. That's the organ that is closest to all of this tissue within the matrix of the fascia. And so if you are stimulating points that work on the kidney vessel, you are going to be stimulating the fascia that's all right in through this area. All of the little muscles that help stabilize across these facets, these tiny little joints in the spine.
Right through here.
And if any one of those muscles gets a spasm, now you're having problems with that nerve root because it's starting to clamp down on that nerve root. And sciatica is the same thing, right? Sciatica is a nerve that's getting pinched between two muscles.
So
usually
with the nerves and that, and I agree with the muscle part too, it can go either way. You can either have where the muscles in spasm flared up. Let's say you did yard work, you were twisting a lot, maybe you were, lifting bags and going down.
Maybe you were doing the boogie, the twist and shout.
Because I've seen it go both ways. Either sometimes that muscle can cause fluid to accumulate in through the area. That'll give pressure on the nerves. You'll feel it maybe go into the glute, down the leg. It can also be if the disc is irritated, it shoots to the nerve, causes the muscle to spasm because the body's trying to stabilize it. It can go either way with it. So we treat the area as a whole with it. And we have different approaches. So if, we work one way and you're not getting the response as much as we like, we work together and you'll probably get a better response treating the whole area. So that's with the nerve part of that. With the sciatic part of it, you have L1 through L5 comes down through here, and they each have a set of nerves, and then you have the nerves of the sacrum coming down through here. So you have L1 through L5, they create this large sciatic nerve that comes down, and I would say it's probably like about that thick coming down with each one of these. That will come down through here. There's a muscle called the piriformis that goes right over it like a rubber band. And if that gets tight as well, that crimps down on the sciatic nerve. So sciatic pain is very frustrating because it's not always just treating the low back. It can have a big deal with treating the muscle and the inflammation and the blood flow.
And sciatic pain isn't just necessarily here. No. It can be presenting down in your leg.
Sometimes you won't even feel it in your back. Sometimes it'll feel like your calf is screaming or the bottom of your foot is burning.
All the way down in your foot on the other end. There's no symptoms up in here. But down below, there's a problem. So then what you have to do is have a competent practitioner who can look at you and say, you know what? Everything down in the feet is testing okay. Testing, what kind of testing? Orthopedic examination. Oh, you mean we actually have to put our hands on our patients? You know how many patients I have come in, and I'm a 2-bit acupuncturist. in the world of medicine, right?
Yeah.
Well, they go to their MD. Their MD sends them to an orthopedic, and nobody does any orthopedic examination. Nobody does any physical exam. They write down in their little blotter what's going on. They ask you some questions. They might go, yep, okay, this is what the diagnosis is. Wait a minute, did you do any exam? How do you know? Did you do any imagery yet? Well, years of experience. Wait a minute. I had a patient yesterday. This is a little bit different, but I had a patient yesterday who her doctor told her that her pain down in here was a result of her stomach being too acidic, and so he was suggesting Prilosec, and he wrote her a prescription for Prilosec. Now, where she's pointing out that the pain is...
It's not where your stomach is.
That's not where your stomach is. Number two, if we actually are honest and do science... I love how everyone's saying, we must do science, and nobody does science. If we're actually going to be honest and do science, we're going to realize that the reason people have reflux isn't because they're too acidic, it's because they're not acidic enough, and that little valve on top, if the stomach is acidic enough, that valve stays shut.
Yep.
If it's not acidic, it opens up.
Floppy.
But that's not even what this lady's issue was.
No, it's
and
too
this
long.
jerk's writing her a prescription. And so I asked her, I said, well, what was his justification? What testing did he do? Did he do any physical exam? Did he do some orthoscope or some, did he run a scope down you? No. He just said that that's what it is. I'm sorry, but that makes me hopping mad. So you want a competent practitioner that not only are they going to listen to you and listen to your story and your history, but they're going to actually put hands on you and be able to figure out what's wrong, as opposed to just you walk in the room 18 seconds later, yeah, I got my diagnosis. Wait a minute. What kind of an arrogant, pompous individual sits back and looks at you and says, oh, I've got my diagnosis of you? No. Each individual is different. You want a practitioner that's going to actually care and have enough passion for their craft to practice the science and the art of medicine and to lay hands on and figure out what's going on. No, enough of my tangent. Sorry.
No, it is important. That's why a lot of people end up going to the MD multiple times before they come see us at times, because they'll go for the mainstream, approach of, you got something wrong, you go to your medical doctor, you think you're going to get a script for what it's supposed to be for, because that's what we're programmed to do from a young age, is you go to the white coat.
Mm-hmm.
And that's when we usually see people coming in when they went and they've done all these things.
Let me ask you,
answers.
In the years that you've been practicing, you've heard that, haven't you?
Mm-hmm.
You've heard people say, wow, you're actually palpating. You're actually touching where my pain is.
Yep.
My doctor never did that, or my last chiropractor never did that.
Yep.
That's frightening, isn't it?
It is. And I mean, some people are brought to tears because they went to so many countless appointments, so much time off of work, and nobody's really helping them like they'd like to be helped.
Yeah.
So
get a good practitioner. Find someone that doesn't chart or charts with a crayon.
All right, let's see. Okay, so we were talking about sciatic nerve. It can track down.
Sciatica. Sorry.
He's a better singer than I am. I'll leave that to him.
Woo, you say the sweetest things.
So, like we said, you can feel it in the foot, not in the back or in the leg at all. Or sometimes you'll feel it jumping from the calf into the glute, into the back. It can bounce around when you have pain depending on what the cause is. It's usually even, whether it's muscle or it's disc, it's never just one thing ever.
Mm-hmm.
That's hardly ever the case. That would make it so easy. I'd love for that to come in, but that almost never happens.
Well, and the other thing is, by the time you're feeling pain,
Mm-hmm.
you're already so far down the road on the injury.
Yep.
which is another reason why, even if you're feeling well, you want to make sure that you're coming into somebody that can, if they're like me, take your pulse, figure out what's going on the very micro level.
Yeah.
Someone like you who
Structurally.
can look at you and say, "Ooh, your shoulder's a little dropped," and then start assessing where that pivot is.
Yep.
Start finding and identifying the adhesions and say, "You're going to be having a problem here in your disc, your L3 disc, unless we start fixing some of this stuff." You're not even feeling any pain yet. You're asymptomatic.
Yes.
But all it takes when you're asymptomatic is a sneeze, and suddenly you become severely symptomatic.
Yes.
So get somebody that can work with you, partner with you, and keep an eye on you and keep you running good. You take your car into Meineke for an oil change. That's where you go for oil changes, right?
I go to the dealer or my.
You take your car into the dealer for an oil change, right? My son and I change it. You take your car for oil changes and preventative maintenance.
We need to do that with ourselves
too. You need to do that with yourself. Yeah. Once something starts to go wrong, it starts to spiral out of control, and it takes one little stimulus, a sneeze, picking up a basket of laundry,
tying a toddler's shoes.
It's
always stuff that people come in there like, I can't believe that this is what did me in. But like I was saying with the muscles, you got compensating muscles. So like I was saying when we started, those big muscles in the lower back, you'll feel they're tightened up. That's just what's triggering your brain that this is what's hurting the most. You still got other stuff going around with all those other muscles around it. And a lot of times when you do have over tight muscles, you have a lot of weakened muscles as well that tight muscle is taking over for. So
excuse me.
There's a big part in low back pain with all the different systems. So like I was saying with tightness, if you have tight hamstrings at the back of your legs, you'll usually have weak glutes, you'll have a weak core, you'll have tight hip flexors, which are in the front. That all throws the back off. And sometimes what you have, like the tight hip flexors, if you have the tightness there, sometimes you will feel it in the back because it has to anchor into somewhere. So there's lots of pieces with this.
When there's asymmetry in the body, you're going to start having problems.
Yes.
And that's one of the things that we look for when you're coming in the door. When I have a patient and I'm watching them walk into the room and I know they're coming in for a pain issue, I'm watching how they carry their body.
Yep.
I want to know, is there a compensatory gait? Is there, are they guarding that shoulder? Are they able to move their head like this, or is their head real stiff? Are they turning their body like this? Again, you want a competent practitioner.
Looking at the whole picture, we're looking at what you're doing for work. What are you doing most often? What's actually causing this pain? Why you're coming in? We're trying to figure that out so we can put a stop to the bad motion or, whatever habits you're doing and try to start out better so you have a better.
And sometimes it's as simple as saying, okay, you sit at your desk with your computer over here all day long and you answer the phone here and you're talking to people here and move. You can't necessarily put your computer right in front of you because you're blocking. So move your computer over here for a week. Every week, alternate. Go back and forth. Why? Because now you're getting that full range of motion built into your body.
Otherwise, you're probably building a muscle on the right side of your back, and you can see it. I can see it when patients come in and lay on the table, and their whole body, it looks like they're twisted up.
They've got that weird hypertrophy on one side, and it looks like you look at their spine in the middle, and there's a big bulge on this side, and there's nothing over here, or it's real flaccid.
Yep, and that screws you up. You want to do anything else, that's still there, and everything else is trying to work around it. So you can have those different things going with it. If the pelvis is off balance because of that, or because, let's say, you do have a weak core and your back really starts to sway because your lower back is taking over for it, that's going to give you issues too. Or you can have the opposite where you have almost no curve in your lower back and your hamstrings are tight and it's pulling you down. That gives you low back pain too. There's just so many different types of low back pain with that.
You've got your low back pain that talks like this, and it has to do with digging too many potatoes out of the ground. Never mind.
Planting them, though, that's been a big one with people coming in.
Yeah.
Doing a lot of yard work and all that.
This time of year, you get a lot of people who have hurt themselves gardening.
Or raking or any of that stuff.
Is it the raking or the rototilling or the shoveling that's caused the pain? No. It's the winter of inactivity, of not doing anything. And now you go out and you start moving.
You put it into high gear and your body isn't warmed up for it, because almost nobody, like before you do sports in, high school, middle school, they'll have you warm up, maybe stretch, or at least, get ready to do some kind of activity. A lot of people just like, okay, we're going to go mulch now. We're going to go throw 50 bags of mulch in front of the house. We're going to grab them off the truck bed and twist and throw.
Aren't they trying to make that an Olympic event, mulch throwing?
I don't know, but
it has a ring to it. They should try.
I really get to see a lot of my patients, though, when they do that, though. They come back to visit me. So, and then I have to try to undo 3 days worth of mulching.
When you've got a lot of patients that do organic gardening, though, the question is it mulching or is it manure? Are they throwing manure or are they throwing mulch? Just a curiosity. I mean, if you injured yourself throwing manure, would you want people to know it? No, I'd lie and say I was throwing mulch.
Yeah, that's true.
Oh, yeah.
Anyways, okay. So other low back pain that can come up would be pregnancy. A lot of moms are having their babies right now. It seems like between March and end of May, I had a lot of new pregnancies that they're finally having their babies now. The sacrum, is it sacral? Sacrum plays a big role in that's where the uterus attaches. So they can feel the low back pain through here, and they're getting that bend because, the baby's growing and their spine is bending more. It's getting more compressed. But if that sacrum is off, it's actually going to restrict the uterus in where the baby is. And sometimes they'll have a harder time having the baby go, head down before they're ready to give birth, or the baby's more constrained on one side and they're very uncomfortable and they have a hard time walking. They get that sciatic pain because of how the pelvis is opening up. That's another part of it too with the low back pain. And also if the sacrum is shifted from one side to the other, that can cause, I've seen with the low back pain with that as well, that you get it deviated and all of a sudden you're getting shooting leg pain with that. Is that something that you normally see too with yours?
Yes. Another interesting aspect is depending on which one of these nerve roots has inflamed tissue around it, or depending on if this coccyx is out of joint and deviated, you can also see a lot of anxiety.
Yeah.
Because in Chinese, once we start getting down into this area and down into the lower part of the sacrum, then you're looking at more of that wood and fire element in the 5-element theory, which is heart and its liver. Well, that is very heavy on emotions. And so, and you think about it, if this coccyx is all inflamed and painful, you're sitting on that. This tissue is being pulled each time you're taking a step. If you're in constant pain and irritation, brother, that's going to make you anxious.
Fight or flight response.
Right.
Inflammation, increased inflammation, other stuff goes on.
Yeah.
With low back pain, sometimes if it's really highly intense low back pain or it's a really chronic thing, you'll also see issues with the colon. See that a lot of times. It'll show up on x-rays even. Like somebody's, they're at an 11 out of 10 pain. They're at their peak. They can't take it anymore. You take a film and you see nothing's moving through the colon. That's common. That goes with the low back pain. One
of the things I always ask a low back pain patient is, how much water are you drinking? Because oftentimes those same patients aren't drinking any water. And so their colon is very dry. One of the functions of the colon is to get the last vestiges of water out of the stool and absorb it. So now it's very dry and it's very hard to get it moved through there, and that colon becomes very irritated, but the pain is on the back side and it's presenting in the lower back. You get that patient drinking water, and having regular bowel movements, that pain goes away.
Yep.
It
goes hand in hand, because all these nerves, like we talked about before, they don't just go to a muscle, they don't just go to the organs. These nerves in that area go to both. So that is why you'll notice two things going on at once. Or as you go up higher into the mid-back, you'll notice heart, lung function, stomach. They all go together. Your body's trying to give you signals of something's wrong here by the external factors, so that you can figure out what's going on the inside to make it better.
That's right.
So
I have seen patients for whom they fall and they injure their T5, and suddenly they start having heart palpitations and end up with cardiac problems. It's not that the cardiac problems are new. The palpitation might be new. Some of that pressure that they're feeling might be new. But the reality is the impact on that vertebrae and that pinching of the nerve root now exacerbated the underlying issue that was already there in the heart. Now, that injury then becomes a good thing, because it's showing that we've got some weakness in the heart that needs to be addressed, and so you can do the intervention. If it's early enough, you can do herbs, you can do a number of things. If it's too far along, then you got to get real aggressive. So when you talk to a chiropractor, chiropractors, you guys are fully invested that working on these nerve roots and adjusting the angles and structure of the spine is going to have a profound effect on everything in the body, organ function, immune response.
Because we're looking at the nerve flow between the nerves that come out here to the heart, to the muscle tissue, to the messages going to the brain. So that's the theory with chiropractic.
And if you think about it, if the supply lines, the neurological supply lines, are working properly, then the organ function getting its autonomic input from up here in the brain. Is that a flip top head? What is that? That function is going to be flowing properly. You're not going to end up with the palpitations per se. Peristalsis is going to be happening through the digestive tract properly. You're getting that proper communication from up here, this little 5-pound nugget of fats, all the way down to the various organs.
And too, if you see it more on this front side, it's not just the nerves that just flow up by themselves going to the brain. A lot of times, most always, you have the artery, the vein, and the nerve. And that's also how you're getting messages as well, if you're helping that flow of blood.
And that's where the acupuncture works, because the acupuncture is working on the vascular system. Acupuncture is a neurovascular medicine. It's often billed as energy medicine. Woo!
And I didn't really understand acupuncture until you really explained it well to me, and that made so much sense.
Yeah. Once you start causing that vasodilation of the arteries and the veins and the venules and capillaries on a much smaller level, then you get more blood flow, which moves out the swelling, which then takes the pressure off of those nerve roots, which also gets more nutrients to those nerve roots to feed them.
Nerve roots and the discs.
And the discs
because
themselves.
That's how they get the blood supply. So, I mean, talking about helping me out. To get my stuff to work better, because sometimes if you don't have the blood supply working, you can adjust all day. But if it's not getting fed, those discs aren't getting fed, nothing's going to really turn around quickly for you.
Yeah. Wait a minute. Wasn't Blood Supply a cheesy romance band from the 80s? No, that was Air Supply. That was Air Supply.
That was before my time. But that's why it matters with all that stuff. You have the vessels, you have the nerves that go together. They support the organs, they support the muscles, and that's what you notice with the low back pain. Also, do we want to jump in with the pelvis too?
Sure.
A little bit with that?
Well,
I'm jumping all around today.
Well, that's okay. You've spent too much time with me. Pain refers. We talked about sciatic pain sometimes showing up down in your foot.
Yep.
Sciatic pain, all of this area in through here is asymptomatic, but you're feeling it down in here. And that's not always the case, but sometimes that's the case with sciatica. So pain moves around. Chinese, we have this concept of wind. No more jokes like last week. We have this concept of wind in Chinese medicine. Wind is present as one of the pathogens when that pain is moving around. So if the pain starts out here and then moves around and starts curling around the body, and sometimes it's showing up in the groin area, sometimes it's back here, sometimes we call that wind. Well, allopathically, it's called referred pain. So if we have dysfunction in this SI joint, this sacroiliac joint, that can show up in the groin. That can radiate and refer into the groin.
Or it can come from up by L1.
Or it can, yes.
Because there's a few ways.
Or even more sinisterly, get my snidely whiplash mustache. It shows up in the foot or even up in here. Opposite ends.
Yeah. So I really didn't even go through for how it refers in the low back, like just the nerve roots. I know I did that last time with the arms. I really didn't do it with the legs. So I'll point those out really quick.
There's still dermatome.
Yeah.
There's still dermatome map of the sacrum. Just like when you were talking about the shoulder a couple of weeks ago, she showed this beautiful, colorful map of all of the different dermatomes, and it showed how with each one of these nerve roots, it wraps out through the tissues of the body, going to which finger. And when there's neck pain, I'll often ask a patient, okay, you're saying that you're feeling it in your fingers, which fingers? And that kind of gives me an idea of which vertebrae. Well, it's the same in the sacrum.
It is.
It's the same in the sacrum and the lumbar spine. Where are you feeling it in your legs? Exactly. Well, right in through here. Well, you just said your whole leg.
Yeah.
What specifically? Take one finger and point to the pain.
Yep. I'm just going to kind of show really quick like where they come down. So this is just straight up lumbar nerves. You can get different pain, like you said, from in the hip, but that comes forward. That's a referring pain as well. But L1, you'll get kind of through the groin here. L2, you kind of come to the front of the thigh. L3, across the knee. Then you get L4, it's more on the inside of your leg right here. L5 sits on top of the foot. And S1, you go more to the outside of your calf in that too. So that's how it refers down through there. And sometimes you will feel it just sticking between, your big toe and the second toe. Come back and forth, but you won't feel it in your back. And that's how we can find for L5, or maybe it'll be that your little toe is falling asleep.
Hey, you wake up!
Little toe.
Wake up, little toe. I'm on a roll today. Man, what did I put in here?
And then sciatic comes in with that too, because they all form into one. So if you have pressure through there, broad-based, you won't necessarily get that pattern that I just showed, but it'll be really random and it'll move around up and down the leg, into the glute, into the hip. So those are where those are mapped out.
And you can always, if you're having any questions, you can always, and I don't normally recommend people go and Google their symptoms, but you can look up dermatome map on whatever your search engine of choice may be. Bing, Google, what are some? DuckDuckGo. Reminds me of grade school.
Yahoo.
Yahoo. You look up dermatome map on these things, and you'll see this incredible map of where the pain can refer in these channels, these vessels in which the pain refers. Now, in Chinese, we look at where the pain is, and we treat that pain, knowing full well that pain is going to be following one of the Chinese vascular bundles. Notice I didn't say meridian. I don't like the word meridian. because in the old Chinese, they never prior to the 1950s, they never translated it as meridian.
Okay.
They didn't translate it as channels. They translated it as vascular bundles.
Okay.
Qi was never translated as energy. It was translated as air, vital breath or vital air. Just one of my pet peeves. So we follow where this pain is, and we look at, okay, the pain's on the outside here.
Mm-hmm.
So where did you say this dermatome was?
S1.
S1. So we look at that and we say, what vessel runs through that area? Well, it depends on what part of S1 we're looking at. It could be the urinary bladder vessel. It could be a referred point to a point related to the Shaoyang vessel, the gallbladder vessel. But we look at that to see where in the body the pain is presenting. And by mirror imaging that pain, we can often end up treating the actual root of the pain, which is kind of exciting. It takes away some of the complicated aspects of the diagnostics. Diagnose the sick meridian, treat the sick meridian. You mean if I treat the sick meridian or vascular bundle, then I'm going to treat that S1 area? You bet. It's beautifully elegant. Now, when something is elegant, it does not mean it's, I can't tie my shoes. It doesn't mean that it's stupid. It doesn't mean that it's simple. Elegant means, wow, it seems so simple at first look, but it's so complex. Mm-hmm. And any part that you take away, now the whole structure is gone. And the body is so elegant in its design.
Like you said, with that, you'll treat equal and opposite with it.
Mm-hmm.
Because we both see people coming in. If they have right low back pain, the left shoulder will be clicking and popping and uncomfortable, maybe kind of going up into the neck and the top of the head, like you said.
Yeah.
My father is one that has exactly that. We had covered that earlier on, how you treated opposite. You're treating more front of the shin, helped with, the colon and everything else like that. But the pain was really up into here. That's how we're able to work with both of them. And it is elegant and complex like that, of all the things that it does affect.
Yeah.
Because you start looking at it and you're like, holy cow, I have all this body pain because of this.
It's a rabbit hole. Mm-hmm. And once you start jumping down that rabbit hole, wow.
Right. That's why I'm kind of all scattered today with it, because there's just so many pieces with back pain. Like if you'd come in with a case, it goes a little bit more streamlined, but sometimes you end up out in left field or right field because it takes you around as you go through the healing process.
And that's the way good medicine should be.
Mm-hmm.
I was talking to a patient who went and had a chelation for heavy metals because her naturopathic doctor noticed that her calcium levels were low. So I know this lady. I know her diet is very, very good. So calcium should not be low because of diet. Hormones are pretty well regulated, so that shouldn't be an issue. Everything, she's as focused as she is on her health. Even heavy metals, she's already been chelated. That shouldn't be. Heavy metals are not necessarily an acute issue for most people.
How old was she?
50s, okay. Early 60s.
So still fairly young with bone breakdown and regeneration and that yet.
So then you have to look at the pattern of this person's life. They go out of the country quite frequently into the tropics, a couple times a year. Wait a minute.
Worms?
No. But when I get a weird lab presentation like that, where some mineral is presenting as low, it always makes me wonder what's eating it.
Uh-huh.
Well, malaria eats that. A form of malaria eats that particular mineral, calcium. So folks that have an active flare of this type of malaria start having lower calcium levels. Fortunately, it's not a real aggressive, nasty malaria, but it's still malaria. She's had it before. I think she said 3 to 5 years ago she had it. She was treated for it because she was having an active presentation.
It's always surprising when you have a person from Wisconsin, then you find out that they have malaria. You know, forget that people leave the state, unlike us, because we love our jobs and we keep working.
Well,
but it blows my mind.
But malaria, remember back 150 years ago, malaria wasn't just a tropical illness. You had people in Pennsylvania getting malaria. You had people in the swamps across Indiana getting malaria. Malaria was the Lyme of their time.
And I guess I never think of malaria as a U.S. disease anymore.
Because nowadays it's pretty well under control. But as we talked about, once you start diving down these rabbit holes, you want some practitioner that's going to be able to start piecing the dots together and say, wait a minute, you are not the textbook presentation. When have you ever seen a textbook presentation?
Hardly ever. I really like it when they come in, though, but...
Well, even those that on the surface seem textbook.
Yeah, that's not always the case.
There's variables that ain't textbook.
And when you start the healing process with somebody, it's never a straight shot to the top you're healed. It's,
Yeah.
Yeah.
So you want a practitioner that has the creativity to put the knowledge that they have gathered after they earned the right to take their board exams. What do I mean? Going to med school doesn't teach you medicine.
That's why we're in practice. We're practicing.
Med school earns you the right to take the board exam to get the license. Then you learn the medicine. Those of us who are very, very blessed by the living God, we have someone to come alongside us and mentor us and say, hey, everything you just learned, table it. I'm going to teach you something now. And they start teaching you the medicine and you go, wow, that's so cool. And you spend a few years honing that. And then you realize, wow, I'm practicing medicine. Most practitioners don't do that. Most practitioners don't have that option, and they're still practicing the board exams.
Yeah, it's not. Even you look up Lyme disease, which we'll have to have a series of Lyme talks, I think.
Yes.
But Lyme disease, what I learned in school, like even with Bordetella, it looked like stretch marks, honestly, in school, but you see it in real life, and it's actually the opposite. Like, you think of stretch marks like running this way down the side. I've seen them running like across the mid to low back, but I've never seen that in a textbook looking that way. I've only seen it in real life.
That, since we're getting close to running out of time, that is a great segue. You watch this show just for the segues, don't you? The segues and the dumb jokes. As we go forward, we actually had, what do they call that? A team meeting last week, a programming meeting.
Hero was like, "Come on, you guys."
Hero was, okay. It's going on 1 a.m. here, 1 p.m. here. It's going on 2 a.m. there, and this Hero is aptly named because he's still up engineering this. We had a programming meeting and we developed a format for the show. Up until now, it was just kind of, hey, Dr. Noel, what do you want to talk about next week? I don't know. What do you want to I don't know. And then it would be Mo saying, hey, what did we decide to talk about the morning of the show? And so we decided we were going to come up with a format. And so what we're going to do is we're going to be rotating. 1 week, we're going to be talking about internal medicine or biomedical issues, i.e. Lyme disease. This week, we're talking about low back. Is it sacral? Then we're going to be talking about structural medicine. Well, I guess this would be the structural. Yep. The week prior, when we talked about mitochondria, that was the internal. So internal medicine, structural medicine, sports medicine, and then family medicine. So we're going to alternate through these, coming up with topics for you. Feel free at any time to interject a topic that you want covered, or wait until this time of the show when we take your questions.
Yeah.
And if we start getting more than just one or two questions, we'll add more room for it. If we don't get to your questions now, at some point, we'll dedicate an entire program to just answering your questions. So this is an interactive exercise. This is going in uncharted territory, if you will. Do you have a compass? Because I left mine at home.
Got it in the truck. Digital.
Ooh. See, the little deal on my truck that has the compass, that died out even before I bought the thing. So we are now at that part of the show where we will answer your questions on health-related issues and anything else your heart desires. So if you do have any questions, you can either put it into Facebook, message us, or you could put it in as the chat, in the live chat on, what is this? YouTube.
Mm-hmm.
I didn't call you anything. Or you can even email us, info@Siloam Center, and it will be relayed to us. So our question today comes from Sherry, who is asking, my Lyme doc says I have Epstein-Barr. What are some of the symptoms of Epstein-Barr? Okay. Number one, what is Epstein-Barr? Epstein-Barr is a retrovirus. That does not mean that it likes to go around in polyester triple knit satin sequined leisure suits. Is that even a thing?
Sure was at some point.
Bell bottom. Retrovirus is the type of virus that it is. And a retrovirus is one that once it gets into your body, it never leaves. Epstein-Barr is one. Polio is a retrovirus. AIDS, HIV is a retrovirus. Isn't herpes a retrovirus?
Yeah.
So you've got this class of viruses that are called retroviruses, and they're really difficult to get rid of. They don't play well with vaccinations either. Vaccines really cause trouble with them, and that's one of the very frightening aspects of this whole vaccine craze of, we need a vaccine for COVID. Wait a minute, we need to test it and make sure it's safe. Mm-hmm. So it's a retrovirus.
It affects the spleen.
It can affect the spleen, but it can also cross that blood-brain barrier into the head. And oftentimes when I get somebody who's got severe anxiety that, it's not responding very well to their medications, they've been on the medications for years, it's not responding to typical Chinese treatment, I get them tested for Epstein-Barr, and boom, we got Epstein-Barr. I got Epstein-Barr on the brain. And you treat them, and the Epstein-Barr starts to go away. Epstein-Barr is also presents as the typically the primary catalyst in chronic fatigue disorder. Okay, someone with chronic fatigue, it's usually Epstein-Barr. And so what do you have? You have severe fatigue, you've got the brain fog, you've got the muscle pains because your muscles just can't function very well anymore. You're feeling miserable. Overall, just feeling schleppy. Can I say that on YouTube, or are we going to get the censors upset? Okay, good. Don't want to talk like a sailor.
You said this patient also had Lyme, correct?
This patient had Lyme. Now,
that's a nasty combo.
But Epstein-Barr is usually a co-infection with the Lyme. Ticks are dirty little critters. Ticks, they don't brush. Have you ever seen a tick brushing their teeth? No, you haven't. They don't even floss either. So when tick bites you, you get bacteria, you get little roundworms, you get viruses. Some of these things we're still figuring out what all they carry. But Epstein-Barr is a biggie with the Lyme disease. So if you have Lyme disease, if your practitioner isn't treating you for the roundworms, some of the co-infections like Epstein-Barr, find another practitioner, please.
Just like we talked about earlier in the show, where, you know, it's never just one thing that's going on. Even with pain that you feel, it's usually more things. It sounds like I'm learning more about Lyme as I work with Mo with this.
She was always into lemons, not limes. Ha!
But it goes that way too. It's never just one thing with this. It's usually a deeper level, and that's why it is so hard to treat.
Victoria, hello. I miss you guys. Say hello to Helmet. The reason we don't have closed captioning is because YouTube's closed captioning is terrible. Just talking about the sacrum, and you'd probably be thinking we were talking about some temple or something. Their closed captioning is terrible. We're still looking into that. Hero is actually looking into that to see if there's some other option. But thank you for saying hi and interacting with us. If you as a viewer, this is your show. We're just the jerks that are sitting in front of the camera. If you have questions or suggestions, let us know.
Mm-hmm.
So that said, can I say it again? I love saying it at this point. You've wasted another perfectly good hour watching this show. But I do hope you learned something. I do hope you learned something about your back pain, something about body structure, something about what you should be looking for in a practitioner. If your practitioner is resting on their laurels, what do I mean by that? If they are practicing their board exams, if they are not passionate about what they're doing, find another one. You don't have to get upset with them. You don't have, no, just find another one. Because the dirty little secret is anybody who wears a white coat or should wear a white coat, a practitioner, any one of us, whether we are cardiologists, whether we are aromatherapists, whether we are MDs, whether we are chiros, whether we are NPs, whether we are ACUs, whatever we are, until we start doing a procedure on you, what are we?
Just playing a character.
Consultants.
Mm-hmm.
Consultants. And what do you do to consultants who give you bad advice? You fire them.
Yeah.
That's what happens in the business world. Mm-hmm. So we are consultants until we start doing a procedure. Your procedure would be your adjustment. My procedure would be an acupuncture treatment. Don't be afraid to get second opinions. Mm-hmm. Don't be afraid to say, you know, Noel, Mo said this. What do you think? Noel's free to say Mo's nuts. I mean, you've seen the show. You know I'm nuts. Find a practitioner that's intelligent, knows their stuff, and has the humility to say, you know what, I can't touch that. I can't necessarily treat that, but I know someone that can treat it way better than me. Or, yeah, I can do that, but let's look at some other options as well. Let's look at some other potential causes. Find a good practitioner. Okay, there goes 1 hour. Thank you for watching.
Thanks, guys.
Next week is the beginning of our peak performance series, our sports medicine, in which we will be discussing, probably talking about a little diet, a little exercise type stuff for how to get the most out of your exercise. Until then, thank you for watching and have a great week. Be well. Shalom.
Bye, guys.